their experience after they've been arrested, what it would take to get someone on a path to recovery. Because the last thing you want is to be arresting the same people time and time again.
Yeah, it's counterproductive. It does nobody any good. You got to look at the law enforcement part of it two different ways. One, the drug dealer, right? These drug dealers are not selling cocaine, although that's horrific. They're not selling alcohol. They're not selling tobacco. They're not selling any other addictive stuff. These drug dealers are selling poison. Killed 220 residents last year, right? We need to pursue those people and prosecute them as much as possible. So that's one under the law enforcement. We're doing a pretty good job at that. That paradigm changed in the last 2 years, really, where it used to be an incident report. The officer would move on, the ambulance would go away with the person that was addicted, and we never see them again. Those are many crime scenes now where we're treating them as potential homicide prosecutions later on for the district attorney's office. The other side is the addict, and our paradigm there is changing drastically. Right in front of us, we're getting ready to roll out with the district attorney's office Project Hope, where we have someone under arrest for criminal possession of a controlled substance 7th, a user amount of an illicit substance. And we can give them the Door A, Door B option. Door A is downtown, Monroe County Jail. Door B, we have these wonderful people at Open Access that are waiting for you, where the police officer can drop you there. We'll give you an appearance ticket. If you stay clean or progressively move forward for 37 straight days, and it's going to be the service providers telling law enforcement that, we'll drop the charges against you, because that's really what we want. We want you getting help. We don't want you sitting at the Monroe County Jail. And then the other part I mentioned earlier, we do have people that end up in the Monroe County Jail. Maybe their charges are too high. They were involved in other types of criminal activity, stealing from someone else as an example. We need to be as best prepared and set up as possible for those people that are going to come in there and go cold turkey on us. That's a serious medical issue Dr. Mendoza could talk about, especially coming from a heroin or fentanyl withdrawal. We got to make sure we're 100% prepared for those people, and then create the path of sobriety for them while we have them incarcerated. So many great opportunities. I mean, this is exciting. What has changed in the last few years, just in a law enforcement standpoint, the whole mindset of arrest our way out of this. Not in a million years we realize that. But some people need to be arrested. Some people need to be prosecuted.
Yeah. Sure. On the subject of dealing, are you confident that you've got a decent handle on it? Is this sort of a whack-a-mole situation where it's difficult to track?
No, we look at daily intelligence now, 24 hours. Within 24 hours of every overdose in Monroe County, we've already analyzed the intelligence. We've already looked at cell phone data. We've already looked at packagings, and if the packaging is the same packaging we're seeing in Wayne County, in Livingston County, and maybe in the town of Webster. We're looking at the commonality. And with the task force model, we're pursuing those guys and gals. With the district attorney's office now prosecuting these cases, I think she has 8 cases. Either she's got convictions on 2 or 3 already, and she's got 4 or 5 waiting in the queue for homicide charges. So I think we're going in the right direction. It's a lot of work to make an overdose case into a homicide case later on, but the work is being done by all law enforcement across Monroe County. This is not the sheriff's department, city police department. Every town is engaged in the same mindset.
And an email from a listener named Matt talked about losing a friend, not just to an overdose, but he said, I haven't heard the word fentanyl mentioned this hour. Mm-hmm. So what I don't know is how often we're seeing heroin cut with fentanyl. I guess I'll turn to Jennifer and Dr. Mendoza for sort of a description of what Matt is talking about. And Matt, we're certainly sorry to hear that. But why don't we make sure we understand what we're talking about when we talk about fentanyl and how it plays in here?
Right. So fentanyl is an extremely strong synthetic opioid, many, many more times stronger than heroin. So the issue here, it was interesting when we were following the data from the Monroe County Medical Examiner's Office, we were starting to see a downward trend until 2016. What happened in 2016 was the introduction of fentanyl into the community, and that's only increased by percentages. So when you look at the ME data and you look at the percentage of deaths caused specifically by the inclusion of heroin, it's gone up to the point of, I believe, we're over 90% now. It's not only cut with heroin, it also can be cut with marijuana, can be cut with cocaine. It's sometimes cut with the lookalike drugs. But fentanyl is a culprit here. So in spite of all that we're doing, that we're really moving forward with prevention, treatment, and recovery services, fentanyl has been a game changer in terms of the immediacy of the death. So the first time...
And if I'm a dealer, why am I cutting it at all?
I know. So this is really the question everybody asks. So why would you kill off your clients, right? As if you're a dealer. But the person that's using hears that message very differently. So originally you think that, gee, let's put out a message to the community. There's some really bad stuff here because it's cut with more and more fentanyl. But someone that's using hears that message very differently. They go, this must be really good stuff, so let me go get some of that, because that won't hit me the same way. I won't experience a fatality. I'll just experience a higher. So you hear the message differently.
Okay. And Dr. Mendoza, I know you've talked about just how much of a disaster fentanyl can be here. If I could, I'll just read a few statistics and I'll let you weigh in on that. I think as we mentioned, 220 people in Monroe County died from an overdose in 2017. That's the number. Sheriff, I think you mentioned the year before it was like 190?
196.
196. The median age was 38 years old, but the ages ranged from 20 to 82. The report says heroin, fentanyl, and its analogs, alcohol and cocaine, often are found together in a person who has overdosed. And Dr. Mendoza, in a separate interview, you said that in 90% of the cases, if people are mixing X and Y, X or Y is fentanyl, and you don't necessarily know it, though. Tell me a little bit more about your concern there.
Well, that's the problem. We are entrusting, for lack of a better word, the future of these individuals to people who really have no regard for their well-being. And if I'm a dealer, I want to continue my business and continue to supply. And the person who's struggling is just using drugs to feel normal. We're taught in medical school that you can't die from opioid withdrawal. And, chemically that's true, but we know in practice that is not true. It is so severe for people who are going through it that some commit suicide. And that is the gravity of what we're dealing with withdrawal. And so when people are struggling through this illness, they will do whatever they possibly can. And Brandon's example earlier of seeing the gas tank on empty and going further, people who are struggling through addiction are doing the same thing. They're just trying to coast by and do what they can. And we need to, that's why collaboration with law enforcement is so important. We can't solve this one from the safety of a hospital or a clinic.
Is there a general estimate that law enforcement or the crime lab or analysts have that for every deck of heroin, if that's the term, that we see on the streets here, what percentage or if there, for every 100 decks, how many are cut with fentanyl? I mean, is it half? Is it more?
No, we're finding decks of cocaine or decks of what we would think heroin. We field test them on the road.
Uh-huh.
Some of them are not showing a lick of heroin in the bag. So we have fentanyl, and we have other cut products in there.
Wow.
It's profit margin. They're making a profit on it. The fentanyl's way cheaper, and you get a better profit margin, and then you cut it with other stuff. And then just last week, the ebb and flow of it, the heroin task force took all heroin off the streets. So that's the Russian roulette people are playing. They don't know what they're buying. They don't know who's producing this. As the doctor said, there's someone at the other end of this manufacturing scheme that doesn't give a lick about them and would kill them in a second. Mm-hmm. And people in that addictive state are not hearing that reasonable talk that we find that's common sense. Why would you play that game? Mm-hmm. But the point we're making is, we're testing bags on the street that sometimes there's no heroin in the bag.
Wow. According to the National Institute on Drug Abuse, among the more than 72,000 drug overdose deaths estimated in 2017, the sharpest increase occurred among deaths related to fentanyl and fentanyl analogs, with nearly 30,000 overdose deaths in that category. So once again, the email from Matt, I appreciate that email, Matt. That's important. And again, sorry for your loss. If you want to email the program, it's connections@wxxi.org. You can call the program in our second half hour, 844-295-TALK. It's toll free, 844-295-8255 or 263-WXXI if you're in Rochester, 263-9994. After our only break of the hour, we're going to come back and we'll have questions if our studio audience here wants to come to the mic and with questions for Sheriff Todd Baxter of Monroe County, who is with us here in studio. Dr. Michael Mendoza is Monroe County Commissioner of Public Health, and Jennifer Farringer, Director of DePaul's National Council on Alcoholism and Drug Dependence in the Rochester area. Let's get our only break of the hour, and we're back with this live edition that you can find on Facebook Live on the WXXI News page and right here on WXXI. I'm Evan Dawson. Wednesday on The Next Connections, the Buffalo News editorial team says it is time for Western New York to get ready to spend a lot when it comes to taxpayer money to keep the Buffalo Bills and build them a new stadium. Do you agree? What is the proper price tag for taxpayers to foot for the bills? Then second hour, the Landmark Society's annual 5 to Revive list. We reveal it. Talk with you on Wednesday.
A year after Harvey Weinstein and Me Too, New York is enacting the country's strictest workplace sexual harassment laws.
You want to have training that goes well beyond sexual harassment. You want it to cover discrimination and harassment based upon any protected category, not just sexual harassment.
That story, plus Justice Brett Kavanaugh's first day on the Supreme Court. This afternoon on All Things Considered from NPR News.
Tonight at 7.
Welcome back to Connections. I'm Evan Dawson. Again, we're on Facebook Live on the WXXI News page, and we're at WXXI today, but we're downstairs in our television studios. We've got a live audience here, and we're going to turn now to the microphone. So right here on the microphone, please state your name and go ahead with your comment or question.
Thank you for this very important program. My name is Scott, and Dr. Mendoza, you said something that really resonated with me. You said that the goal of medicine is firstly, do no harm. We hear that as being the hallmark of medicine all the way around. And we've heard from the sheriff about these dealers who are really very nefarious and so forth. The piece we have not heard about in this particular segment is the medical industry, Brandon's story, that his path to opioid addiction was initiated in the medical establishment, initiated with opioid prescribed pain medication. And so many people are victim to the overuse of prescription opioids and the medical industry that profits from it. What do we do about that?
Thanks for your question. You're absolutely right. And I think it's important wherever I go to speak to an audience that I acknowledge that as a physician, as a member of the medical community, that we played a very important role, unfortunately, in the genesis of this crisis. And so, as I see it, one of the tenets of our opioid action plan is through the advisory panel that I've convened, trying to educate my colleagues on the appropriate treatment of pain. We got into this, unfortunately, because we were trying to treat pain in a way that was, now we know, not entirely safe. And we don't want to make that mistake again. And so part of our work is to educate people about how to treat pain appropriately, because we want to acknowledge that pain is very real, too. We don't want to alienate those who struggle through chronic pain, because that's a disease unto its own. But you're absolutely right. I think it's important for us in the medical community not to be defensive about this, to own what happened, acknowledge what we did to potentially contribute to the issue, and more importantly, figure out what we can do as a community. And it's unfortunately not a solution that we can own entirely, but there is a good part of it that we need to own, and that's part of my goal as the commissioner.
I know you are certainly aware of people who are on pain medication for various reasons. I think of people like my mother, and they would be very fearful of living without the possibility of using an opioid for pain. And I wonder what the message is for them, because when we've had this conversation before, in fact, we had a live broadcast where we simulcasted in Cleveland and Portland and Rochester, and did the subject of pain management. There's a lot of fear out there that this is going to result in eliminating opioids entirely, but I know, I see you shaking your head. I know you don't think we ought to eliminate opioids entirely for pain management, but generally speaking, do you have an idea that it ought to be a lot less in terms of prescription? We ought to try other methods first? Where do you think we're headed with this?
Well, the CDC has come out with recommendations on how to more appropriately treat chronic pain with opioids. And their recommendation also is not to get rid of opioids completely. It's to think about the individual patient, think about the risks and the benefits of all of the different treatments that we're going to consider for that individual. But there is unfortunately no easy way to take care of an individual, and so we've got to meet that person where they are. But I definitely acknowledge that there is significant fear, and I feel it in the office when I see somebody with chronic pain. They're already on eggshells because they're worried that I'm going to take away their opioids. And the reality is that we need to consider people from the standpoint of what they're going through and what their individual circumstances are.
Let me read an email from a listener named Stephanie who is in the audience today. She says, I'm so grateful to be in this audience. I'm an addict in recovery from alcohol, prescription pills, and a long-term eating disorder. I also have multiple college degrees, a successful career in business, a family, and friends around the world. My point is that addiction wears the face of everyone. It's the great equalizer. What are the opportunities for those of us in recovery to be involved in the recovery of others in the county? Can we make those resources available? That's from Stephanie. It's a great question. Jennifer, I'll turn to you on that.
Yeah, I would say, I mean, you heard the voices from Recovery Fitness. That's but one. So Recovery Fitness, become involved, work with them. CORE is another drop-in center located on West Avenue. You know, those come right to the top of my head. Certainly educate and help us work together to eliminate the stigma. Also, in a community, if you're part of a community coalition, there's school community-based coalitions in, well, for example, NCADD is through our Finger Lakes Prevention Resource Center. My 3 staff support 20 coalitions in the Finger Lakes region. Those are school community-based, whose focus is really to address the variety of addiction-related issues in their communities. So I would certainly say that, you know, help take the time to become trained in Narcan, have a Narcan kit available for this particular. So if you come across someone, obviously you can reduce the likelihood of a fatal overdose. And most importantly, work with us to help erase the stigma, erase the lack of true parity in our system.
Okay, a follow-up, a call from a listener named Luann in Rochester said that just wanted to follow up on what she was hearing from Dr. Mendoza. She says her daughter recently had surgery where Advil was enough, but she went home with medication that was way too strong in her estimation, and she wants to know, is that still an issue today? Do we see either overprescription in terms of, you know, if someone, I guess, just needs Advil, and it's probably hard to know what you need at that moment, but what would you say to Luann?
It's still an issue, absolutely. And I think that's why the voice of the community is so important. Whether you're a patient or somebody in another setting, you know, we really want to hear from you. And I would love to be challenged when a patient says to me, no, doc, I really don't want to take that medication for whatever it is. And then my response is, help me understand why. And tell me more about what you're feeling, and tell me more about what it is that's, you know, helping you to feel in that way. But no, it's absolutely still a concern. I had the opportunity to speak to the Dental Association here in Monroe County, and I reviewed the data on opioid prescribing. And as a community, the dental community prescribed, you know, less than 1% of the total opioids in this community, which, you know, by every measure seems like a good thing. But then when I dove into the data more deeply, and I looked at the age breakdown from the age of 10 years to 29 years old, dentists prescribed 60% of the total opioids in this county. Mm-hmm. And the number one reason for that was wisdom tooth extraction. So for all the wisdom teeth being pulled out in this county, I would encourage everybody to, you know, have a respectful conversation with your dentist and say, is this the right treatment for me? And I think that's a conversation that we all could have with all of our individual healthcare providers.
All right, Matt, who emailed earlier, follows up to say that he thinks that someone who deals drugs that lead to death should be charged with murder. Sheriff Baxter, do you agree with Matt?
Yeah, absolutely. Unfortunately, our penal law does not agree at this time in New York State. That's a very difficult charge to place on someone. You got to show that depraved indifference. You got to show, for a murder charge, you got to show that intent. You know, and sometimes this drug dealing goes second, third party before it ends up in a needle in someone's arm. So backtracking all that information and then putting a puzzle together that it's prosecutable, that's the key here. To hand to the district attorney that she can prosecute is very difficult. So right now we're going for the manslaughter charges, which are much easier to prosecute. Unfortunately, they're equal to usually the criminal sale of a controlled substance, or even criminal possession of a controlled substance. They're equal in weight in our penal law, but I think we're trying to also make a statement that if you take a life, we're going to charge you for taking the life of another person, in addition to the sales and the possession charges. But yeah, Matt's absolutely right. The penal law has not caught up to this epidemic. We are pushing our legislators forward on that. We're asking them for better laws for this. You know, if you sell poison on the streets of Rochester or any other community and it kills someone and it results in the death, that should be a murder charge. We all agree.
You keep calling it poison. You're very direct about
Yeah,
what,
there's
what
no
it
gray
is that
area.
we're talking about here.
No gray area. Yeah, I worked the streets of Rochester during the crack epidemic, and that was horrific, and a lot of people died, but most of it was violence. It was this is different than anything we've ever seen, and this is directly resulting in the death of people the moment they stick that needle in their arm. I mean, I can't think of a different term to put it. It's poison.
I want to bring our attention to what Monroe County has been doing, and the county executive, Cheryl Donalfo, who will be on this program later this month, has called for an opioid action plan, and there is various individuals involved with that. I know Dr. Mendoza is certainly helping lead the way with that. Where does the opioid action plan sort of stand, and how has that been rolled out so far, Doctor?
Well, I think the plan is a great start, and as much as hope is important, hope is not a plan. And I'm very grateful that our county executive identifies the need for a plan that is fluid. When we look at this plan, I take it on the road and I solicit feedback from my colleagues. And I just had the opportunity to speak at the New York State Association of Counties meeting last week and heard some great feedback on our plan. And I also think that this community has good reason to feel blessed that we have a plan that is looking at so many different aspects of this problem. Is it to say that we're done? Absolutely not. We need to keep looking at the plan. We need to keep revisiting it. But it's important for the people out in our community to know that there are others in this community in very high leadership roles that have their back, and we're not coasting on this one. We're full on gas with this, and we're doing everything we can.
I think it would be interesting to know if you've traveled much or been on the line with other communities, just because this is a problem everywhere. This is a national epidemic. And every community is trying different things here, admirably so, desperately so in some places. And you would think that if there is somewhere where it's really working, if there's some community where you've cut the deaths by 50% in 3 years and something is happening, that we would know by now. I don't know that that's happening anywhere, is it?
Well, I looked at Erie County, and Dr. Burstein's a colleague of mine. She's the Commissioner of Public Health in Erie County. And I look at what Erie County has done. They've made some great improvements. And I also know that because of the circumstances in their healthcare system, they have different dynamics that they have to manage. And just because it's going to work there doesn't mean that we can copy and paste it and have it work here. And so to the extent that this is a national epidemic, it's also a local epidemic. And we've got to figure out within a given community, what are the resources that need to be mobilized to find a solution.
Okay, and on the subject of prevention, I know Jennifer Farringer wanted to talk about that. So let's talk about prevention. And the pessimistic side of me would say so much of our drug crisis has come from sort of economic despair, communities that where people are growing up where there are no longer either the job sources, the factories, the companies that there used to be, that there isn't necessarily an economic path to sustainable life in the future, that has led to hopelessness, poverty, and eventually to drugs. And until we work on some sort of an economic agenda that changes that, I don't know that we can dent the drug problem. Is there some truth there? Is there, can we work within that even with those, sort of those parameters?
There's some truth there, but I think this epidemic, more than any, has really shone the light on what is the face of the addict. What is the face of this epidemic? What does an addict look like? It could be any of us, right? It could be any of us. So it's not limited to those communities within our community, larger community that are impoverished. Certainly that's a driving force when someone has no access to insurance, to care, doesn't know about resources. But I would say that it's certainly impacting the burbs, the suburbs, just as much, the rural communities as much. It's across the community, and that's why I say prevention, in terms of marshaling our folks, our communities through the activism around community coalitions. And that becomes even a more localized response versus the Monroe County response. So you could look at what's happening in Webster, what's happening in Fairport, what's happening in, so the community coalition gives you even a more pinpoint view. So yeah, I agree that that's a driving factor, but it doesn't say all. And to say that, it kind of discounts the fact that addiction impacts us all.
Okay, so in a moment we're going to get another audience question. I want to let our listeners know that Second Opinion, which is shot right here in this studio, is covering the subject of pain management post-opioid epidemic. It's November 8th at 8:30 p.m. on WXXI TV. November 8th, 8:30 p.m. on WXXI TV. And just to briefly follow up on prevention, key number one then to prevention right here in our community. We've heard the sheriff say so many times, you can try to arrest your way out of this, but we've got to stop it before it begins here.
do.
Key
We
number
do.
one is what, Jennifer?
Community education, community I can't do one. I can't,
I
you
know.
know I can't do
You're
one.
right. Yeah, I know you
it's
can't.
two. So
And
it's
it is too
community.
complex.
Yeah, it's community education at the earliest possible level, elementary, middle, high school. Don't wait till high school. Start early. Reach out to families. So we do as much work supporting the families through the chaos of this crisis. If we don't do that, we're not going to change anything going forward. And again, back to the coalitions. You know, we've got to have everything working together to solve this.
Okay, Dr. Mendoza?
You know, and I think Jennifer's referring to the impact of trauma on, you know, health outcomes. And we know that trauma plays a huge role in the kinds of illnesses that you're describing, be it drug use, be it suicide, be it violence. And we also know that in this epidemic, trauma is not the only predictor. And we know this because when we look at the data and the people who are struggling, who are suffering, who are losing, don't fit any easy description. We cannot put the people who struggle through this illness into nice, neat buckets.
Okay, let me go back to the audience now. Please state your name and go ahead.
My name is Danette. I wrote an email
Oh, hi,
earlier.
Danette, that's you.
Yes, hello. Long-term recovering alcoholic, thank God. I think my question was just about answered in at what age should education in the school systems be introduced? And I wonder, when I took health class, say in 5th grade in the Greece school districts, you know, nothing was mentioned about drugs or alcohol, be it the decade, you know, that was occurring in. But I guess I wonder what's happening now and how old are the kids when they're first make contact with this information.
Danette, thank you. It's a really important question. Go ahead.
And I think that varies from district to district, and certainly, you know, I say NCADD is small but mighty. So we have 2 educators working with several school districts, but we have other prevention programs in town as well. To answer your question, it's never too early. So the earlier, the better. Does that mean you're starting out with specific information on methamphetamine? No, perhaps not. You're starting out with healthy choices, you know, working with kids to understand signs, symptoms, talking about healthy families, working with families in that way too.
Yeah, I'm curious to know what you think, Dr. Mendoza, in terms of ages and what's appropriate.
Well, you know, I think that's where we look to our collaborations with early childhood development. You know, as a physician, you know, somebody who sees a little kiddo in my office for 20 minutes, and I see, you know, early signs of things, I know that it is so hard to really connect with that individual in that short 20 minutes of time. And that's why, you know, as I view public health in this community, we've got to figure out how do we make those bridges between medicine and outside of medicine, because medicine cannot solve it all. You know, these kids that, you know, I see that are struggling in a variety of ways, but they're as young as 1 and 2 and 3. You know, and I see the environment that they're growing up in, and I understand that, you know, families are just doing the best that they can, and if they make choices that are not unhealthy, it's not because they have this intention to be unhealthy.
No, but struggling, when you say 1, 2, 3 years old, struggling how?
You know, parents who live through violence. You know, the impact of domestic violence is profound. The impact of violence in our community is profound. The impact of even smoking and excessive substance use in the home has a huge impact on that developing child.
So in our final minutes, then, I just want to ask our guests to tell us their outlook here, what you think is realistic. I mean, everybody is hoping that the epidemic would be gone tomorrow, but Sheriff, you know, you've been in the job, you've been on the ground with this, getting your hands dirty with this, and it's a very, very big problem. What's a realistic goal for this community when it comes to the opioid crisis?
Well, I think that you take it incremental and go back to my military training, right? You got to cordon off the problem. You got to set an inner perimeter around it. And I think that's the education piece, the slowing this epidemic down and let us get our hands around it. And then the recovery beds and law enforcement and all the other systems won't be overwhelmed. We got to keep on going back to the prevention. I agree earlier. It's not, I was with a person that was a recovering addict yesterday, and she was telling me about how she taught her 4-year-old to administer Narcan. You know, think of the trauma in that young kid's life. We're never done, but I also want to give a sense of hope. We keep statistics. We are starting to analyze the data almost instantaneously. I almost feel that with all the creative mindsets and the synergy that we have in this county, I think we're plateauing. I say that with a lot of reservation. I wish I had some wood to knock on, but I'm willing to say, it feels like we're getting traction. It feels like we're getting the message out. It feels like people are engaged throughout the whole community because it's in everybody's backyard, and I think people are starting to realize that, and that was the first step we had to get out.
Okay, 20 seconds, Jennifer.
Oops, sorry.
Are
I
you
go
hopeful?
back to access, and we've created things in this community that are totally out of the box that are now being replicated in communities across New York State. So, I think again to echo what the sheriff said, we're using all our creative strategies. There's no idea that's a bad idea, and we're lucky to have the support of OASIS, New York State Office of Alcoholism Substance Services, who are willing to look at things outside of the box. So I'm hoping, to predict down the road. It's a complex problem. It's not going to be over tomorrow. I'm hoping we're at a plateau level, but I know for a fact that we have increased services exponentially, and that's recovery, treatment, prevention across the board.
20 seconds, Dr. Mendoza.
I think it's important to recognize that, prevention for addiction is critically important, but right now we are facing an epidemic of overdose, and we've got to apply what we know about prevention to overdose. So learn about Narcan, do everything we can to prevent the next fatality.
4 years old, I understand the horror that some people have for talking about Narcan with kids, but whatever the case is in your community, I understand it's important. Learn about Narcan. And continued good work to our guests here. Our thanks to them, and the audience can thank them now. Thank you very much for being here. Dr. Mendoza, Jennifer Farringer, Sheriff Baxter, we appreciate your expertise. Our thanks to Rob Braden, the engineer, Megan Mack, producer, and all of the wonderful team that put together this live broadcast here with a studio audience, 2 hours on the opioid crisis. I'm Evan Dawson. Have a wonderful afternoon. We're back with you tomorrow on member-supported public radio.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station,